Okay, perfect. All right. Hello, everyone, and my name is Dr. Erica Liggins, licensed clinical psychologist and founder and CEO of Crush That Exam. I have been an EPPP coach for the last 6 years, and I've had the pleasure of helping all sorts of people from all different walks of life to overcome their licensing exams and launch wonderful and successful careers. Give me one second. I'm just going to pull my microphone over a little bit closer. And so I'm really excited to be here with you tonight on behalf of Psychologists of Color to talk a bit about how to get your support system ready and thoroughly engaged in this process so that they can be a help to you rather than holding you back. But before we do that, I want to tell you a little bit about who I am and why I'm an EPPP coach so that you know where I'm coming from. So again, 6 years ago, I started being a coach because a dear friend of mine said, you absolutely need to help people. And I was making the transition from working in community mental health to being in private practice and then later going on to start my own private practice. When I was in that like transition period, I was looking for some other things to do outside of doing private practice on the side. And she said, one day over lunch, she was like, you really need to be a coach. And then other friends were jumping in and saying, yeah, you should be a coach. You helped me pass. You helped this person pass. And I had never thought I would do something like that, but everybody kept saying I should do it. And I was like, well, maybe I'll give it a try. And so I just kind of put it out there and started working with people and very quickly saw the carnage that was going on out there, seeing people who were getting, beaten up by this exam, and seeing their finances being held back, job opportunities, seeing how it was impacting their career development, their personal development, being able to achieve personal milestones. And I thought to myself, oh, wow, people really need help. And the reason why I'm so passionate about helping other people is because I know how overwhelmed I felt when it was my turn to take this exam. See, as a person of color with a diagnosis of ADHD, I was not exactly looking forward to taking this test. In fact, I was so riddled with anxiety, it would make me physically sick every time I tried to study or even think about studying. I would have panic attacks, crying, sobbing in fetal position. Literally, this is not hyperbole. This exam terrified me. I felt like I had come so far and was afraid that this would be the thing that would stop me. Because every other standardized test I'd ever taken, I had never done well on. But thankfully, after a lot of avoidance, I pulled myself together, did a lot of praying, and figured out how to study for this exam in a very structured way that really worked with my neurodivergence and helped me to really master the content and build really strong test taking skills that I had never had in my life. And thankfully, I walked into that exam on August 5th, 2015, and I passed on the first try with a score of 659 as a woman of color with neurodivergence and a history of very poor performance on standardized tests. And so it was through that experience as a marginalized person who's also first generation to go to college and all those things that I knew once I started coaching people and I saw how much people were suffering, I wanted to do things very differently than other coaches out there. I wanted to support people and do it in a way that's affordable and accessible so that people like me could get to the finish line. And it has been an absolute joy ever since then to really help people out there who are struggling with this. And I've worked with new test takers. I work with people who have been out of school for several years and have never taken the test. I've worked with people who have taken the test dozens of times, literally, and helped them to pass, which is why I have a fervent belief that everyone can crush that exam with the right support, mindset, and plan. And so for today, we're going to be talking about the importance of having your support system be a part of this process in a productive way. So let's start off with talking about the fact that your support system can either be the thing that helps you cross that finish line, or they can be the biggest deterrent. And there's a lot of reasons for that. But let's start off with even defining who our support system is. We've got friends, family, colleagues, peers at work, and your employer is a huge part of your support system. Also, neighbors, any type of community organizations that you're involved in, like if you belong to a church community, for example, or maybe you pledge in a sorority or have done that and, you have sorority or fraternity brothers or things like that. So any other type of organizations that you're involved with can also be a major support. And also people who live far away from you. In today's society with, modern technology, people don't have to be down the street from you to be a help and to show up. They can be there for you in so many different ways. So when we actually involve our support system and we enroll them properly in this process, they can help us so much. It helps this process to be so much easier because they're more likely to respect your study time, to understand what it is you're up against. They're more likely to, help you to be focused and productive by staying out of the way when they need to. And you're going to be much more focused. You're going to have less stress, be less overwhelmed, and have more chances of passing when you have the right support. Let's see here. Oh, someone has a question. Yeah, that's fine. Okay. So let's see here. We've got, let's talk about some of the ways that people can show up and help, ways that you might not have thought of. Because we know that studying for licensing exams, especially the EPPP in particular, we're talking 15 to 20 hours a week of studying for 3 to 6 months. This is like the worst part-time job you've ever had. But it doesn't pay anything. It's stressful, it's exhausting, but at the same time, it will lead you, of course, to make more money, more opportunities. But in the meantime, it's like taking on a part-time job that's super stressful. And so anytime people can take the load off of you, take pressure off of you in other ways, that frees up your time and your mind to be able to really focus in on this process. So, for example, meals. We know that working and studying and cooking is hard. So if you have friends and loved ones who can cook meals for you, send you like what is those food delivery companies where they give you the food, maybe it's already made and you just warm it up, or they've already done the meal planning for you, so you just have to cook it and put it together. Either one of those can be really helpful, or just dropping off meals at your door if they live close by, or sending gift cards to order out can be such a way to give you some support and take some work and pressure off of you. And that also includes things like house cleaning too. I had a coaching client years ago who was pregnant and they were so exhausted and overwhelmed, and a family member volunteered to do their laundry for them while they were studying for the exam. And that really, really, really helped them and took something off their plate. Also, people can help financially. Money, money is also a huge help. All of this is really expensive with the materials and the test fees and whatnot. And so when you have family that can do a little crowdfunding, that's also really helpful in helping to take some of the costs off of your plate. So that just names a few ways in which people can help you, but also other things, right? Like emotional support, cheering you on, actually saying things that are supportive and helpful and that can keep you motivated, checking in on you, accountability. Also, sometimes providing a place to study. Sometimes I've had coaching clients where their friend or family were like, "Hey, if you need a quiet place to do your practice exams, You can come down, take a test in my basement. I won't bother you. You just never know the ways in which people can show up, but you have to be the one to ask. Now, in addition to our, ways that people can help us, we also have, like in terms of personal family and friends, we also have our employers. So often, employers have so many resources and ways that they can help you. But again, you have to ask. So in my coaching program, I actually have a checklist that my coaching clients go over with their employer where they can ask for support. Because if you don't know to ask for these things, they sometimes aren't going to tell you. Sometimes they may not even know certain ways that they can help you until you ask. So that includes things like professional development days that you can take in the days leading up to your exam, because you shouldn't be working up until the last day of your exam. That's not a good idea. So, wouldn't it be nice to use professional development days rather than your personal time off, right? That's one way that they can be a help. Sometimes employers will actually pay for test materials or pay for the exam or pay for coaching because they really are invested in supporting you. So they might have like what do you call it? Professional development funds that you can utilize for helping you with managing the cost of the exam. Also, a lot of employers will allow you to um, study at work. Do any of your employers allow you to study at work?
I'm sort of not working right now. I took time off to study, but
Okay.
because I did not pass, I am now starting to pick up more work. But so I kind of like right now set my own hours. So, but that's really not going to be too sustainable too long. But for right
Yes.
now, I am.
Yeah. No, I hear you 100%. And here's the thing, once you get back to work, uh, I would definitely inquire about that. What support can they give you to help? For sure. Earl, were you gonna say something?
Oh no, I was gonna answer too. But yeah, I came back in November uh, last year, and then I was trying to. I've applied, but I'm not working either at the moment.
Hmm.
Yeah, so I'm in a similar position as Dr. Rosalind, but
Gotcha. And there can certainly be benefits of when we take that space so that we can just focus on studying. Uh, Toward the end, we're going to have some open time for Q&A, and I would remind me, and I'd like to give you a couple extra tips that could be helpful for someone in your situation. Because there are a lot of pros to working or studying full time, but there also can be some cons too. And we can talk through how to make sure we manage the potential cons that come with it. All right, so we can clearly see that family, friends, employers can help with everything from finances to childcare to meal prep to time for studying, etc. But why does this sometimes not happen? Why do they sometimes end up just not helping us? And a lot of it has to do with the fact that we just don't ask. Closed mouth doesn't get fed. And now, why don't we ask? Well, a lot of times it's because we're super high functioning, right? We're used to being the person that has it all together, that does everything. People are used to coming to us for help. So it feels weird to be the person who's asking for help. It may also feel like certain people in your life, you can't ask them for help. Maybe they've got certain challenges or things that they're going through. And so it doesn't feel like you can ask. Maybe there have been some past disappointments or ways people have let you down when you did ask for help. And so now you feel weary about doing so. Maybe you don't want to be a burden. There are so many different reasons, especially for people of color, too. There can be this push for hyper self-reliance and fear of being vulnerable and asking for help at times. And so all of those factors can really play a role in why we sometimes Do not ask for help, even though there's people around to give it to us. And so it's really important that you begin to reflect and think about what are these barriers that are holding you back from asking for the help that you need. And it's not also too just about asking for help. It's also setting boundaries is another reason why people can't help us or why they make it difficult for us, right? So let's think about some of the ways that loved ones actually cause trouble. They don't mean to, but they do if we allow it. So interrupting us, literally, like you're trying to study, people are coming in and asking questions, trying to have conversations, asking you to go do fun stuff. And if you have the choice between sitting there and studying or going out and watching a show, watching your favorite show, what are we going to pick, right? So, has that ever happened to anybody on the call tonight where loved ones kind of interrupt or distract?
Yeah, my daughters call me all day long. And my husband, like, you need to tell them, turn your cell phones off. But then they're grown, but I'm afraid that they're gonna need me. And
Mhm.
once I tell them I'm studying, they'll go, "Oh, I'm sorry." But they know that I'm studying, but they still call anyway.
Laura, oh, hi, Laura. Glad you're here.
Hi.
So
Yeah.
thank you. Oh, yes. So we're so happy to have you here. So, Laura, we're just to kind of tune you into what we're talking about. We are talking about the ways in which our support system sometimes distracts us, causes us trouble when we're trying to study. And Dr. Roslyn did a great job of giving us a real life scenario that happens, right? And so I want to pick out a couple of things. And this is usually textbook example of a few different factors coming together. You're a mom. People always need you. Even when they're grown, they always need you, right? And so there's never a shortage of ways in which you can help people and stay in that helper role all the time, right? And we see that colliding with a lack of boundary. No, let me actually say not a lack of boundary because you did set a boundary. You said, guys, please don't call me when I'm studying. But I hear a lack of enforcement of the boundary. So usually one of those things is off. Either we don't ask for help or set a boundary, or we do set a boundary, but then we don't enforce it, right? So we have the phone right there. Perfect opportunity for somebody to just call. And then when that phone rings, we answer. And then after the fact, it's like, see, you guys, you disrupted me again. So, what needs to happen is that I'm coaching you right now. You didn't even hire me to be your coach, but I'm coaching you right now. So, it's ultimately in your hands to see to it that these boundaries are set and enforced. So, what has to change?
Me and my enforcement, I mean, follow through is kind of like either turn my phone off. My husband said, just send them a text, let them know you're going to be studying from, 10 to 2, not to call you. If there's an emergency, they can call him. You know, I- I know that, but
Yeah,
my heart is like, oh my goodness, I need to be available for them. I really don't, and I know that. So
yeah.
I have to cut it off, cut it out myself. So I need to enforce it. I need to hold my boundaries. They're very supportive, but they always, for some reason, want me to know that they're thinking of me too. So I think that's also what they do. They want me to know that they care about me. So they're always checking on me.
Mhm.
Mom, you okay? You okay? Don't let me have a sniffy nose or something like that. Oh my goodness, they want to carry me to the hospital, but I love them.
Oh,
But yeah,
that is so sweet. Now you started off by, and thank you so much for allowing us to use you as an example. This is great. So you started off by saying, I always worry and I feel like I have to be there. So what I would invite you to do is to begin to look at those beliefs because we all know this, right? Our behavior comes out of our feelings and our feelings come out of our thoughts, right? So you're not going to feel comfortable to do what it is you know you need to do, which is put that phone in another room and turn it off. You're not going to do that until you shift your thinking around something bad is going to happen and I have to be the one to fix it. So, what might be a new thought? Because listen, you're a mom, these are your kids. You love your kids, you're always going to be there for your kids. But what's a different way of thinking that is less catastrophic, that can still be sensible, reasonable, and allow you to study in peace?
Um, I don't know. I know that they trust in the Lord. God will take care of them. Um, I'm not the answer. I'm not really sure. I know I should know. I'm just so used to, when they call, I'll go, what's the matter? And I really should not. And I don't
Yeah.
know where that comes from, but
It's called being a mom, is what it is. And here's the thing, in my coaching program, we have an audio program where I teach people how to pass this test, and we have a recording that's specifically for mothers because this is a real
Mm,
thing. And parents too, but more so for moms because this you can't easily turn that off. So I just want to throw something out there for you to try on, which is these are adults who are capable of caring for themselves. And 98% of the problems they're going to have are not things that have to be solved during my study time.
yes,
And God forbid if something, that 2% of serious crazy things that could happen, if any of those things happen, someone will find me and get a hold of me. They will call your husband. Your husband will come in that room and he will say, drop everything. This is what's going on. True or false?
absolutely. 100% true.
So you're not going to abandon your kids because you are going to set up a way for them to still get to you if there truly is a real emergency.
Yes. Thank you.
So we have to
Mm.
shift our beliefs. And that goes for not asking for help because we feel like we should always do everything on our own, or because we don't want to be a burden on people, or because we don't think we need it. Everybody's got beliefs that they're carrying around that's preventing them from utilizing their support system fully. And so you have to do some soul searching to look at what those beliefs are. And in my coaching program, let me tell you something, only 20% of it is about here's how you study. 80% of it is this part. It's the self-reflection part. It is the mindset part of how you're approaching this whole thing. And that's ultimately how we pass that exam. So, when you show up to this process aware, self-aware, right? And you are unlearning beliefs that keep you in hyper independence and lack of utilizing support. And you begin to open your mouth and ask for help, as well as set boundaries and then follow up on those boundaries. Then you will begin to see things working for you. I've had people, let me give y'all the tea today, okay? I have had people swear up and down. You don't know my family. I have to do everything. If I don't do it, nothing will get done. Da, 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 da. They've got tons of proof. because they have enabled the people around them to be so reliant on them that they're constantly get reinforcement that yes, they have to do everything. And this isn't just with family, this is even in the workplace. People are overwhelmed, overworked. They're taking on too many cases, but then they're volunteering to take on more. They're volunteering to take on every initiative. And then we're overwhelmed and feeling oppressed and unsupported by the systems around us, but we like kind of set it up that way. So we got to do soul searching. Why do I keep volunteering for stuff? Why do I keep take caring for people who can care for themselves? What is this about? Just making sense, y'all? Rosalind's like, I get it. I love it. I love it. I love it. All right. So let's keep on moving. All right. So, how do we get people to get there, right? The first thing is they have to educate them. Raise your hand if you're first generation to go to college. Okay, got a few folks. Raise your hand if you're first generation to have a professional license. Because maybe people have gone to college in your family, but maybe they don't have a professional license. Okay, so we got a few folks. All right, so licensing exams are tricky little buggers. And a lot of people in your friends and family may not know a lot about what they are, why they're so difficult. I remember people in my social circle asking, like, I thought you were done with school. Why are you still studying? Like, I went to your graduation. Like, what? Or I saw pictures of your graduation online. Why are you still studying? And it's because this is just something that's very new for them. And so we have to educate them about this process and the test and what it means and what it takes to study for it, the stress that's involved in it. Because here's the thing, sometimes you might tell them and they just don't listen because they're like, oh, you're overreacting. But when someone else tells them, then they perk up and listen, which is why um, we actually educate our coaching clients and their families. So we have a whole page on our website that is specifically for the friends and family of test takers, including employers. There's a page for them too. And we have them go there so that they can learn not only about the exam and what it takes to prepare for it, but also how they can be supportive and also things to avoid. Because it's better to come from me than to come from you, right? So I do the dirty work for you. I tell them, hey, listen, they may not be able to come to every family event. They may not be able to pick up every phone call. They may not be able to spend as much time with you. They may not be able to be there for you with as much emotional support as they typically give you for this period of time, because that's how important this test is. So we help to lay that foundation for you. So as you're learning to set those boundaries, you have a little bit of support to do so. Because does anybody feel like their families just don't get it? Raise your hand. Yeah, absolutely. So let us help them get it so that you don't have to. All right. Now, once families understand what this process is, they are starting to be aware of how to, like things that they should avoid and things that they shouldn't say, things that they shouldn't do. And they start to be aware of how they actually can be a support. Now we're on a roll. And then another thing you want to make sure you do before I forget is make sure you don't tell people your test date. Telling too many people your test date causes so much pressure, so much anxiety, and so much stress. I tell people keep it under 5 people if possible. I've even, and to be honest, I prefer less than 3 people because the less people that know, the better, because it keeps them from a lot of people from reaching out to you like the night before your exam, the week of. It's like you just get to keep like yourself focused without all this noise. And they mean well. Like none of this is coming from a bad place. But who needs 20 text messages the night before? Are you ready? You ready for tomorrow? And it's like, I don't know. I think I am. You don't need that. You don't need that. So when people ask for your test date, you tell them, I'm not allowed to tell you. You pick two or three people that really do need to know, maybe like significant other, stuff like that. Although I've even had some of my coaching clients who don't even tell their significant other. Like there's anyone who knows they're studying, but they don't even tell them the date because it's just too much pressure, too much anxiety. So you got to do what feels right, but definitely tell as few people as possible. Okay, so back to what we're talking about. So once people are educated, they know what to do, what not to do, then we can begin to make a plan of how they can help you. But remember to be open and flexible. Sometimes you might be expecting certain people to be the people who are going to help you. And they may not always be able to show up for you the way that you need. So you might find that friends or extended family or neighbors, people who you wouldn't think are your initial circle of people, might end up being the very people who can support you the best in this journey. So be open, be flexible with how you ask for help and who you ask it from. And remember, sometimes people need something from you in order to be able to help you. So have those open dialogues of like, hey, this is what I need from you, and be specific. I need you to not call me between this hour and this hour. Don't just be like, I need space while I'm studying for this exam. What does that even mean? No, I need you to not call me between 6 and 9 p.m. every night unless you are dying or someone is dying or something. Like it's got to be that clear. Or I need you all to pick up this house chore and that house chore so I can get more time back in my schedule to to put towards studying, for example. And then be like, is there anything you need from me to help you to do that? Because they might be like, hey, I need a reminder, right? Because if you don't ask that, then they don't follow through. Then you're upset. Then you're coming to coaching sessions. I told people I needed this. I told people I needed that. And they're not following through. Well, did you find out how you need to help them to give you what you need? Oops, right? So those are some of the things that are really important that you need to make sure that you know. Now, let me check my notes to see if I missed anything. I think we got mostly everything. Oh, really important. When people ask you or they go to give you help, take it. So often we just will follow all these things, but yet because we're still holding on to something that's keeping us from receiving help, we don't take it in the end. So you got to accept the help, okay? And when you go to ask for help, don't stop people before they even get a chance to consider it. So let me give you an example. My coaching clients know that in those recordings, I specifically give examples of ways that friends and family can help them. Again, meals, financial resources, emotional support, etc. And so those who are still struggling to accept help, they might say, well, my coach says you got to listen to this recording on how to be a support and how to help me. But just so you know, I'm not looking for anything. You don't have to actually give me anything, though. Do you see how that cancels out, right? What was the point of even asking for them to learn about how they can help you if you're cutting them off at the knees before they can even have a chance to even think about how they could be a support. So you've got to let people help you. And also, before we turn over to questions and comments and whatnot, remember too, we want to keep our relationship strong during this journey. And even though you're not going to be able to give as much time and energy as you normally would, that doesn't mean we completely cut ourselves off. We have romantic relationships that we want to keep strong, relationships with children, friends, what have you. So I always suggest to people to think about quality over quantity. You may not spend as much time with your people during this time, but be mindful of creating quality time. So for example, if you're used to spending hours every night hanging out with your family, that might not be the what happens for 3 to 6 months. But if you can have a few minutes each day, maybe during dinner or something like that, where phones are off and you're just really connecting and talking and really being present, followed by maybe once a week family night for a couple hours where you are truly in it with them. That makes up for 10 hours of sitting there watching TV together where nobody's talking, no one's hanging out, you know? So just think about that. Same thing if you have romantic partners, keep a date night, you know? Maybe with friends, it might be a monthly gathering where you sneak away for a few hours and just really be present and tell them don't talk to you about the exam. So often people go to spend time with their loved ones and they so bad are looking for that as a break from studying. And then the loved ones are asking them about the test. And again, it's coming from a good place. People are trying to be helpful, but they don't realize you need a break. And so that's again where you've got to set the line and say, hey, when we get together for date nights during this time, I don't want to talk about that test. I don't want to think about it. Don't ask me about it. Same thing with outings with friends and family as well. Be like, you can check out on me other times, but don't talk to me about it when we're trying to hang out. So just keep those things in mind, and that will help your relationships to stay strong because I've seen people who have come to me and they're like, my marriage is on the brink. My relationship with my kids is frayed because this test has taken over my life. And we don't want that. So, what I want everybody to think about is who are your cheerleaders? How can they be helpful? And what boundaries do you need to set and enforce to help you to be successful? So, with that, I'd like to get some questions or comments from you all.
So I want to first say thank you. I don't want to monopolize all the time, but I real quick, I do want to say thank you. I also want to say that everything that you said definitely resonated. I've done most of everything. I just didn't do it well enough, obviously. So I have a very great, thank God, supportive family, maybe too supportive to where I start to feel guilty because they're supporting me so much. Um, so I don't know what else. Maybe it's a learning thing. I mean, I've never had problems with tests, anything. I mean, studying, none of that. So I'm not sure what's happening. It could be an emotional thing or something. Um, I don't know how to really even verbalize um the structure that I had. Obviously, it wasn't successful. Um, but I don't even know what to say. I do resonate. Everything that you say resonated with me. I tried to approach those things. Obviously, I'm not being effective in my approach. But I don't know what else to do at this point. I'm kind of like at my last wits. So I'm gonna stop with that because I don't even know if I made sense or if what I said even mean anything.
No, it all makes sense. And first of all, you're welcome. So glad that you're here tonight. Uh, let's work on managing those feelings of guilt and just allowing people to be there for you. And then when it comes to the test itself and the challenges that you've had, um, so in my coaching program, I go over with people the common mistakes that people make that causes them to have difficulties with passing. And I'll quickly blurt out a couple, which include lack of structure in this study. It's just kind of haphazard. A lot of people struggle as well with really using active study methods. It's very passive. Their content knowledge is often very surface level. And many people do not use practice tests effectively. They use them too often, too little, or not enough, and not at the right times in their study journey. And they ultimately end up walking in there just really underprepared. And if there is a lack of confidence or high test anxiety that's not being fully addressed, that further complicates things. So, what I would want to do is to help you to figure out, which we would have to do outside of this, of course, to figure out where the link is or where the missing link is. But in 6 years of coaching, I've never had an instance where I couldn't figure out what it was that someone was missing. Yeah. Does anyone else have any more questions or comments about our topic today?
Hi, thanks for doing this.
You're welcome.
Um, I have a very heavy client load, and that is what interferes with my study.
Mm-hmm.
Any thoughts on that?
Oh, I have thoughts for sure. So thank you, Laura, for the question. I would say at least half or more of my coaching clients, the beginning of their journey in the coaching program is getting their work-life balance under control. In fact, I was just talking to someone this evening about this. We were reflecting about when they first came to the program, and their work-life balance was non-existent, and there was no time or energy to study. So the very first thing that I would want to work with someone on in your case is to really make it a goal over the next 30, 60, or 90 days, depending on how bad the situation is, to get your work-life balance under control, which may mean taking some very definitive and drastic measures. Sometimes we have to reduce our caseload, well, first of all, we stop the bleeding. We stop taking on anybody new. That's a given. And then we also get rid of any clients that aren't fully engaged. Any clients that are stable and can reduce, we reduce them. Any clients that are a bad fit or too intense, they need a higher level of care, we connect them to the right level of care. Because sometimes we don't want to let clients go when we need to, right? And so we make sure we get them to the right place. Oops, so sorry. Alarm going off. There we go. And over time, you start to see that come down.
Okay,
Does that make sense, Laura?
it does.
The other thing, Laura, is you have to do some soul searching to find out, how did I get myself into this? How did I get here? Is
Uh,
it that I wanted to make more money, so I took on more clients? Is it that I was trying to help the organization? Is it that I didn't know how to say no? Is it that I get really excited when I see interesting cases and I just say, yes, I'll take that case, not thinking about how full I already am?
okay.
What do you think?
Well, the money is really important, but
Yeah.
also it doesn't help. I have two businesses going on in addition to my practice. So, yeah.
We need to scale down.
Overextended.
Yep. And high achievers do this. We're talented, we're smart, we're driven, and we just do too much. We just do too much. And so, what I want you to think about, Laura, and this is for everybody actually, um, keep big picture in mind. Like, yes, working more and working harder brings in more income and whatnot, but the income that you lose month over month by not being licensed, as well as the cost to your mental, physical, and emotional health, is so much greater than what we would gain by continuing to work at the pace we're working. So really sit down and crunch numbers and look, like if I do this another 6 months where I'm working crazy like this versus if I were fully licensed, how much more could I work or how much more can I make and less and making that amount typically working less, right?
Yes.
So you really got to sit down and do that math because I was talking to someone recently who just started a program and they were like, over the last however many years that I've been unlicensed, they were like, I probably have lost $500,000 in revenue.
Wow. I never really thought about it in those terms. But I do know the difference between LPC license and psychologist license.
Yes, thousands of dollars over the course of months and years doing the same work,
Okay.
right?
Thank you.
You're welcome, Laura. Thank you. So it's been a blast, y'all. I absolutely love teaching about this stuff, watching people set boundaries, transform, and set themselves ultimately free of this exam and seeing them reap all the rewards of going through the process and then launching amazing careers. So I want to thank you all so much for coming tonight. And I'm going to take a second to do some final announcements. So I'll go ahead and stop the recording here.